Most people take their sense of sight for granted, and it's admittedly easy to do. We don't even think about the fact that we are able to recognize others from a distance, watch movies, or watch this video, and even those of us with less than perfect vision just need to throw in some contacts and go about our day. But for some people, this just simply isn't a reality. Take one of my good friends, Michaela Myers, for example. We met in marching band in 2017, and I initially noticed that her eyes seemed wobbly, but I didn't think much of it. As I got to know her better, I worked up the courage to bring it up, and she was luckily very open to talking about it. She has nystagmus.
Nystagmus is when my eye muscles twitch and move uncontrollably and involuntarily, and they just kind of shake around and bounce all around my eye socket.
This sparked my interest the first time she explained it to me, not just because it was intriguing, but because I couldn't fully wrap my brain around it, and still can't, to be honest. How does one see the world completely differently than everyone else, yet still carry on and lead a meaningful life? I wanted to learn more, not just to clear up my own questions, but also to get a deeper understanding of what life is like for Michaela and others with nystagmus in an effort to better empathize with them. So, I dove headfirst into the research pool in hopes of achieving just that. Nystagmus, by definition, is a spontaneous and inappropriate oscillatory movement of the eyes that disrupts steady visual fixation. It is relatively common, occurring in about 24 out of every 10,000 people, and is rarely inherited, even though it is possible. The condition has two main types, congenital and acquired.
I have the congenital nystagmus, yeah, that's the one, where I was basically born with it, and I've had it my whole life. I don't know anything different other than this is what this is how I live my life. This is what I know.
Children born with nystagmus don't usually start showing symptoms until about 6 weeks to 3 months of age. They will initially see the world as just blurry rather than shaking, which is usually associated with nystagmus, and this condition most often occurs in both eyes. Congenital nystagmus is sometimes referred to as sensory nystagmus because the eyes have an impaired ability to see and sense the world around them. Acquired nystagmus, on the other hand, appears later in life. This can be due to medical conditions or even drug or alcohol use. The different types of nystagmus are characterized by a degree of conjugacy, planes of oscillation, directions of gaze, and amplitude or frequency. For example, pendular nystagmus is characterized by eyes that oscillate like a sine wave, while jerk nystagmus means that the eyes drift in one direction with fast, corrective phases. One reason for nystagmus to occur is that the areas of the brain that stabilize eye movement do not work properly. The cause of this is sometimes unclear, but it is also sometimes related to other eye problems. Nystagmus can be related to a wide array of health conditions such as albinism, cataracts, inner ear problems, multiple sclerosis, stroke, head injury, certain medications, and alcohol or drug use. The most common symptoms of nystagmus is rapid and uncontrollable eye movement. This is usually side to side, but it can also be up and down or circular and can vary between slow and fast tempos. However, other symptoms related to nystagmus can manifest themselves, including sensitivity to light, night blindness, tilted head, and feeling like the world is shaking. All of these symptoms can contribute to nystagmus diagnosis by an ophthalmologist. They will examine the inside of the eyes looking for other associated eye problems such as strabismus and cataracts, or even a problem with the optic nerve itself. They may also perform a battery of tests to reach an official diagnosis. The ophthalmologist may spin the patient for 30 seconds and then leave them to focus on an object. If they have nystagmus, their eyes will move slowly in one direction, then rapidly in the other direction. They may also take recordings of the patient's eye movements in order to confirm the type of nystagmus present. An ear exam, neurological exam, and brain imaging are also common contributors to a nystagmus diagnosis. I was curious how Michaela's diagnosis compared, but upon asking her I found out that she was too young to remember, which is likely the case for many people with congenital nystagmus.
When I was diagnosed, I was 3 months old, and it's actually kind of a funny story. My mom took me to that doctor because, I didn't act like a normal baby. I was not registering certain things babies were supposed to be registering with my vision, and my mom took me to the doctor, and they dismissed her, and they were like, nothing's wrong with her, this is normal, she'll be fine. And then I think it was either a student becoming a doctor or a nurse, someone that wasn't the doctor was like, the doctor's wrong, I'm gonna write you a referral to a specialist. And so they did, and what's his name? The ophthalmologist, I think that's how you say it. He diagnosed me with my nystagmus when I was about 3 months old.
I truly can't imagine how difficult it was for her parents to be dismissed by the doctors. To think that a medical professional would downplay the concerns of a parent, the person who knows the child the best, is beyond me, though I know it sadly happens often. Even though symptoms aren't forefront and obvious in cases of children with congenital nystagmus, it is disappointing that the doctors failed to acknowledge her parents' concerns. I'm glad that they made it to an eye specialist so that she was able to get the care that her family knew she needed. Care and treatment for nystagmus is dependent on the type of nystagmus. People born with nystagmus cannot be cured, but things like glasses and contacts can help slow the eye movements. Surgery is less common, but it can be done to reposition the eye muscles so that the person doesn't have to turn their head as far to keep their eyes from moving. This spot where the eye movement is least is called the null point and can be achieved by turning the head to a certain spot or tilting it to a certain angle. In the case of Michaela's congenital nystagmus, I knew that she wore contacts, but I was curious if she's undergone any other attempts to lessen her condition.
Basically, for as long as I can remember, really, maybe 3 years old, I started wearing glasses. That's a way I've kind of fixed my vision or corrected it, yeah. Started wearing glasses. I actually hated wearing them, so I would never want to wear them. And then when I was 7 years old, at the start of second grade in 2009, I got an eye surgery to correct I forget what it's called, but to fix my null point, where I can best focus and my eyes will be less shaky and I can see things. Before it used to be right here, I would be looking over my glasses, so kind of wearing them was counterproductive. And so they fixed it to the point where it's kind of right around here-ish, and I can still wear glasses and, have my eyes be less shaky. And yeah, so they did that surgery. And then when I was about, I want to say 13 years old, I might have been in about 7th grade, I got contacts for the first time, and that was life-changing. I, felt like I got to experience things like makeup, for the first time I got to feel like I could experience makeup, because wearing glasses, I was no one's gonna see it, so why bother? But now with contacts, I can, practice wearing makeup and do all this. And also, I feel like I can do a lot more because glasses can sometimes get in the way. I can actually wear sunglasses now and, experiment more with fashion and stuff, and kind of, become a different person. With glasses I'm a different person, and with contacts I'm a different person. Got these personas.
In terms of acquired nystagmus, it will likely go away if the condition causing it is treated, such as treating a medical problem or stopping drug or alcohol use. Recent research has led to a deeper understanding of the pathophysiology of acquired forms of nystagmus, allowing for potential drug therapies, while congenital nystagmus remains restricted to surgical therapies. Some forms of nystagmus are affected by body positions, either made worse or better by laying down or sitting a certain way, etc. Recreational drugs like marijuana can lessen eye movements, although many of these treatment approaches have not been clinically evaluated. Medications and other pharmacologic treatments attempt to dampen nystagmus and improve visual symptoms without affecting normal eye movements. There is no doubt that life with nystagmus isn't easy, since impaired vision can impact nearly every aspect of life. I asked Michaela which parts of her life are most affected by the condition.
My vision impacts basically every aspect of my life. I feel like I kind of experience things differently than other people. I don't know, describing types of distance is different than what other people would, because my depth perception is also affected by my nystagmus. So it's some people are oh, that's 5 feet away. I'm that looks a lot farther away. I'm that's not 5 feet away. Other things that my vision has affected in my life are kind of how I perceive myself, I guess, because I've been seen as weird by other people because my eyes just kind of woo everywhere around. So people probably see me as weird.
It's tough to imagine the mental battle involved in a condition that completely alters the way you see the world. I know that if I saw the world differently than anyone else, I would feel like an outsider, or that I was somehow invalid. This makes me sad because I want nothing more than for others with chronic conditions to feel accepted and unique in a good way, but why would I not view it that way for myself? This got me wondering how people with these conditions still manage to live their life to the fullest. How can you feel so isolated and apart from everyone else yet still achieve all of your dreams? How do you work past your physical and mental limitations? I asked Michaela this.
How I've been able to work around my condition is just kind of like not really caring what other people think about me. I used to be like that a lot when I was younger, and kind of way I work around it is just like live my life to the fullest that I can, and what I can do. And I've also like surrounded myself with people who also like don't really see me as just my eyes. Like they see me as like the person I actually am and have gotten to know me better, and really like they kind of like also kind of forget that I can't see very well, which I also forget I can't see very well. And so I just feel like I'm one of the boys.
To be honest, this outlook on life is super inspiring. Here I am with 20/20 vision, with contacts of course, and she has to completely adjust every aspect of her life due to her eyesight, and she still manages to crush whatever she puts her mind to. I would be undoubtedly envious of those with perfect vision if I had nystagmus, so I was curious to find out her opinion on what others take for granted in terms of their eyesight.
I think others kind of take for granted how easy it is for them to like do things. Like for me, I still don't have my license, and I'm 19 years old, and like it's like a struggle for me to drive, and like actually driving is really scary and something very hard because I have to pay extra attention to what I'm doing, and it's very stressful. That's how I would put it. And like people can just like it takes a while to drive, obviously, like learn and be comfortable driving, but people that just have like really good eyesight, or like maybe they don't have perfect eyesight but they correct it with like glasses or contacts and can see 20/20. I can't. Like I will never see 20/20 even with corrective like help. They can just do things and not have to worry about it, and I do, and that's something I have to deal with like my whole life. And I feel like people just take for granted how easy things can be for them in the world,
This interview has definitely opened my eyes to the things I take for granted daily in terms of my vision. I've never considered how difficult this world would be to live in with impaired vision, from reading the board in class to determining when to cross the street. This world is built for the able-sided person, and that sadly doesn't account for the millions of people who suffer from impaired vision. After learning more about nystagmus through Thak's and Michaela's first-hand experiences, I have gained a greater appreciation for not only my own health, but also the human body in general. It is amazing what we are able to do to overcome the problems we face, whether it be a minor inconvenience or a chronic condition. I'm really glad that I had the opportunity to talk with Michaela about this, because I wouldn't have come to that realization otherwise. To close out the interview, I asked her if she had anything else she wanted people to know about her condition.
It doesn't necessarily define someone. Like, although it is a big thing about me physically, like it's something I think a lot of people will notice at first when they see me or like meet me, are my eyes. And it's not something that is like a whole person. Although, sometimes I do make it my personality trait, like I'll make jokes about it and stuff like that. It's not everything someone is, and there's like a person underneath like the physical appearance, and that goes for anything else really too.
I think that is an important thing to bring up. Why do we walk on eggshells around conditions that we can tell people have? I think we as humans are afraid of the unknown, so we don't know what to do when we encounter someone who looks different. I think that's a big takeaway from this project. Different doesn't have to mean scary. There are people who live their lives differently than the average person every single day, and they don't complain. In all honesty, everyone lives a different life, so no one should have to feel ashamed for their differences. After researching this topic and having this conversation, I know that I am better equipped to handle a situation involving someone with differences. We are all just unique versions of each other, and there is no shame in that.
Sports, I'm really bad at sports. I cannot play a sport where you have to throw things or hit things. And a way I've kind of worked around that is I don't play sports. Go, Michaela! I can catch when I want to. I just choose not to. This is so unhinged. Life is crazy, man. My eyes be going silly, goofy mood. I'm just in a silly, goofy mood.